Well, maybe you can relate to this, or maybe it will surprise you. But a new report shows that British Columbians seem to be drinking less alcohol than they have in 20 years. And Statistics Canada is showing declining alcohol sales across the country. Our medical columnist, Dr. Melissa Lem, who is with us today, joining us again. Thank you so much for your time. Dr. Lem, this report out of the University of Victoria looked at pure sales in BC. So it says with one standard drink equaling different amounts of beer, hard liquor, wine, cider. And they also show that since the peak of the pandemic, these sales have dropped about 15%. What do you make of this?
I would say overall dropping alcohol sales are really great for our healthcare system. And I think it's summed up by this one recent quote from the World Health Organization, which says that any level of alcohol consumption is not safe for our health. Within Canada, we spend about $20 billion in healthcare and economic costs from alcohol.
Wow.
And it's actually classified internationally as a Group 1 carcinogen on the same list as tobacco, asbestos, and radiation. And this is because it increases the risk of at least 7 different kinds of cancer, including bowel cancer and breast cancer. And I have to say, this is different from what we'd heard over the years. In medical school, I learned that moderate alcohol consumption can be good for your health in some ways, particularly for cardiovascular health. But recent analysis of the evidence shows that the risks outweigh the benefits. So I think we really have to look at alcohol as something, as an indulgence, as something that we rarely consume. And Canada's guidelines say now that low-risk drinking equates to no more than 2 drinks per week, and actually no alcohol is safer than any at all.
Now, also, Statistics Canada, their report shows a similar decline. In fact, even beer sales across Canada are the lowest since 1949. That's when they started tracking it. But it also shows that cannabis consumption is going up. So do you think this is kind of like trading in one vice for another?
Well, the first thing I want to say is that we definitely have more research on the health impacts of alcohol compared to cannabis, probably because alcohol has been legal for a lot longer than cannabis. In terms of the similarities, both alcohol and cannabis can impair your judgment and response time, which if you use and drive, which is obviously not recommended, that can increase the risk of car accidents. Also, long-term use of both alcohol and cannabis can increase your risk of heart disease, and particularly in developing brains in young adults, it can permanently affect their structure and function because brains develop until you're about in your mid-20s. But if you want to look at the differences, alcohol use is increased with an increased risk of, associated with a higher risk of violence, whereas cannabis, for example, isn't. And so I would say the bottom line is that regular use of both is not considered safe.
All right, well, thank you, Dr. Lem, again, for being with us today. And that, again, was looking at consumption of alcohol being in a 20-year low.